So here you'll see what a typical ingrown toenail procedure looks like, and this is what a typical ingrown toenail looks like. The nail cuts the skin and creates an infectious process, and it's very painful. Sometimes it's red and it can have drainage coming from it. So after the patient's toe has been anesthetized, which it's already been done here, a tourniquet is applied around the base of the big toe. It's held in place with a hemostat throughout the procedure to prevent any bleeding during the procedure. A special nail nipper is then used to free up that piece of nail that's creating the ingrown toenail. Now, quite a bit of nail resides underneath the skin that you can't see, and so a small blade is used to free up that portion of nail that rests underneath the skin. After that's done, a hemostat is then used to gently roll out that piece of nail that's creating the ingrown. So here you can see as I roll this piece of nail out that all that nail was underneath that patient's skin, creating that ingrown toenail. A curette is then used to free up that border to make sure that there's no other nail or tissue or infection that's left. Now after that's done, if you're doing a matrix procedure, which is the permanent toenail removal procedure, then phenol, which is an alcohol that prevents the cells that grow that nail from growing new nail. So it effectively keeps this as a permanent procedure so that patient doesn't get an ingrown toenail on that border again. This procedure is typically done with patients that are chronic ingrown toenail sufferers and have repeated ingrown toenails. So after the phenol is applied, that cotton tip applicator is used to dry out the area. A curette is used again to make sure that there's no nail or debris or skin remaining. And then a bandage is applied. So again, this procedure is done for patients that suffer from chronic ingrown toenails. The recovery time is about 2 weeks. You'll do dressing changes at home. Your only restrictions are no soaking in bodies of water such as swimming pools, bathtubs, lakes, rivers, that kind of thing. Your goal is to keep that dressing clean and dry so that no infection occurs. Again, the recovery time is about 2 weeks. We'll see you again at 2 weeks to make sure everything's healing okay. And after that, you don't have to worry about having an ingrown toenail in that border again.